Hi, Dustin Schaefer here with Prove It. I have a really good friend of mine here with me, Dr. Scher. Brett, kind of tell us a little bit about who you are, about what you represent, and then we're going to kind of talk about sodium today.
All right, great. Well, thanks, Dustin. Well, I'm a cardiologist. I've been in practice for a little over 10 years. But my real focus, my real passion in cardiology is prevention, just health promotion and preventing disease before it even starts. And that's why I started Boundless Health, to really be able to work with people one-on-one in a much more detailed fashion than you can get from traditional healthcare, to really find out what it's going to take for you as an individual to get you to your path of your best health.
Awesome.
Yeah.
But I know you and I got to work together, and I see your work on a regular basis,
Yeah.
and I appreciate, especially somebody with your expertise and understanding, to kind of take a little bit of a leap out here and say, hey, listen, I want to really address total health and total wellness.
Yeah.
One of the things that I get a lot of questions is around sodium. Our product, Keto OS, has sodium in it. It's actually really important for the product because it's a binding and it helps the absorption of the ketone body into the body. So I wanted to just kind of ask you, what is the kind of the ideal sodium levels that a person should consume, and what would you say to somebody if they ask that question?
Yeah, it's a great question, and it has been controversial recently because we all need sodium. We can't live without sodium, and it's crucial for us for our what we call our homeostasis and our body mechanisms. But there was studies a decade ago that showed eating more sodium raises your blood pressure by a few points. And from there was an assumption that then must lead to more strokes and heart attacks and heart failure. Therefore, sodium is bad. I emphasize that was an assumption. That was absolutely never proven. And over the past couple of years, there's been a much better detailed analysis of all the studies that have been done that show there's no correlation necessarily between sodium intake and adverse heart problems or health problems in general, until you get way out there to like over 10 grams of sodium per day, which is a lot of sodium. It's hard to eat that much sodium a day. Interestingly, they also have found what they say is a U-shaped curve at the very low end of sodium, less than 1,000 milligrams or 1 gram of sodium per day. You can also start to see some problems, namely with your kidneys, because your kidneys need sodium to function. So in that middle ground, sodium's fine. There's really no harm to sodium. So if somebody asks me what's the right amount of sodium to eat, there really, isn't much of a danger to go ahead and liberalizing your sodium intake. For the general population, there's no danger to just eating whatever you want for your sodium. It's hard to eat too much sodium. If you think about it, fat, salt, and sugar are the things that people, add to food to get it to taste better. But you would never take a salt container and just pour it in your mouth. You just can't eat that much sodium. So to me, it's not much of a concern, and the literature supports that.
Very cool. But also, ketone bodies are a diuretic. So we notice that sometimes in the research out, especially out of Ohio State, Dr. Volek talks about, increasing sodium level when people are either are in the state of ketosis.
Sure.
So we might find that they need just a little bit more, but probably not to exceed 10 grams.
Right.
But they might need a little bit more. And interesting enough, we live here in Southern California, and I find the problem bigger here than I do in the Midwest. And I think partly because bigger meaning that they may need more,
right? Because
people here tend to be health conscious and go extremely the other way.
And it's interesting, at Boundless Health, we see a lot of our clients come in complaining of muscle cramps. And one of the biggest reasons is they're actually deficient in sodium because they're watching their sodium intake, they're out playing golf for 5 hours in the sun, or they're out exercising, biking, and they're still restricting their sodium intake, and they are salt deficient. And that's why they're getting muscle cramps and they're lightheaded. And we actually tell them to start eating more salt.
Now, what salt would you recommend? What would you suggest if somebody says, I'm going to have more salt? What would you tell them to use? Because I do believe that there's probably different qualities of salt.
And that's true too. The sea salts, the Celtic sea salts, those are going to be, better for your body. There's going to be higher quality salts. And whether you just want to put a pinch of that in your water to get some, whether you want to sprinkle it over your eggs, whether you cook with it, that's what I would recommend starting with.
Perfect, excellent. So sea salt, more natural salt, maybe avoid the regular old school table salt that we have?
That's more refined. It's gone through much more processing, and so you want to get to sort of the more natural.
All right, really cool. I appreciate that. So sodium is not bad. We just got to find what's the right amount for you. and be okay with playing around with it, and it makes you should feel comfortable, and it's really hard to overeat.
Now, I would say there are some people who are going to be salt sensitive, and they'll notice their ankles get a little swollen, or they might actually gain a little water weight. So I think that's more the exception than the rule, though. We've sort of been trained to think that that's what happens to everybody.
Okay.
That's definitely not the case. In small substance, that will be the case. So you have to just be aware of it. But if that's not you, then no restrictions.
And if you're that person, then cut back on the sodium
Yeah.
in your day-to-day diet and in your day-to-day life.
Yeah.
And if you're going to use Keto S, then you may have to reduce sodium in the rest of your day.
Sure.
Or maybe start with a lower dose of Keto S and to get the benefits of the ketones if that's what you're trying to do.
Good point.
All right. Thanks, sir.